According to the World Health Organization's World Health Ranking, someone in Jamaica is more likely to lose their life from prostate cancer, lung cancer, breast cancer, stomach, cervical, liver, uterine, and even ovary cancer before they'll ever go from bladder cancer. Now, the rarity of this illness drafted local statistics at 0.34% of the total number of deaths in the island in 2018. That's only 62 people. But of course, that's 62 people too many. And maybe, just possibly, 62,000 people not having ever heard of this disease until now.
So the bladder is a small muscular organ that is in the pelvis, deep down in the pelvis. Its purpose is really to store urine. Now, cancer, as has been said before, it refers to the unregulated abnormal growth of cells, and in this case it would be the bladder. So bladder cancer is unregulated growth, usually from the lining of the bladder, that is abnormal cell growth. So the signs and symptoms of bladder cancer, usually the commonest sign is usually hematuria. Now what hematuria is blood in the urine. So usually it's painless hematuria, maybe painful hematuria, which is pain along with blood in the urine. Also, there may be irritative bladder symptoms, or as we would say, storage, lower urinary tract symptoms. Some of these include urgency, frequency, going to the bathroom frequently, waking up often at nights, it's known as nocturia, and in general, some dysuria, which is like burning when you pass your urine.
Now, before you experience any of those symptoms, there are some causative factors that lead to bladder cancer that you may want to assess first. It simply means that while it happens, it's usually preventable.
The commonest causative factor for bladder cancer is cigarette smoking. It's actually associated with about 50 to 60% of bladder cancers. There are other risk factors which are known as occupational hazards. So individuals who work in the industries and have prolonged exposure to aromatic amines, aromatic hydrocarbons. So in the textile industry, painters, those who work with tar, amongst other occupational hazards, are at risk for bladder cancer. Patients who also have, for whatever reason, they'll have chronic irritation to the bladder. So there's a parasitic infestation known as schistosomiasis that's really associated with bladder cancer also. Patients who have chronic catheters, indwelling catheters, as well as bladder stones and a few other things that cause chronic irritation to the bladder.
Now, bladder cancer is very picky when it comes down to gender, with the likelihood of displaying its sprouting behavior on men more often than women. And while the data shows that you don't necessarily need to be thinking about this until you're well over your 40s, there is proof that it affects many of us who are nowhere near to collecting our pension. Wow.
The older you become is the more at risk you are. Usually not before the age of 40 that bladder cancer is seen. It's more common in the 5th to 6th decades of life. 5th, 6th, 7th decades of life. It's actually more common in men than women, and this is thought to be associated with lifestyle amongst other things. Bladder cancer is very treatable. In fact, most bladder cancers present as organ-confined disease, meaning that they're absolutely curable. The treatment options include definitely surgery. This involves what is known as a transurethral resection of the bladder to actually get diagnosis, and in some cases is curative if the tumor is completely gotten. This involves passing instruments through the urethra, which is the opening through which you pass urine from the bladder, and that allows us to see the tumor. It allows us to resect or scrape the tumor away from the bladder wall, and in some cases we may or may not give intravesical immunotherapy or chemotherapy depending on the risk of the disease. But that's usually how bladder cancer is initially treated.
So now may be a good time to just pause for a bit and think about the causes, signs, and symptoms of bladder cancer. And if you've been treated from it before, remember to get your regular checkups because bladder cancer has a high recurrence rate. Watching from the sidelines or the confines of a bed can be a bit of a sting for some, piercing for others. So let's go stronger and healthier together by prioritizing our health.